It's a pleasure to be here during the 15th Annual Conference on Aging as part of the think tank on hearing in later life. I'm Heidi Sveistrup. I'm the CEO of the Briere Research Institute and Vice President Research and Academic Affairs at Briere Continuing Care. I'm also a keen researcher, and I have with me here today Dr. Matthew Bromwich. He's a physician, TED talker, surgeon here in Ottawa, and inventor of the Shoebox audiometer. We're here today to talk about the role Shoebox has been playing at Briere. Hi, Dr. Bromwich. Would you like to give us a short introduction?
Sure. Thanks again for having me. And again, it's a pleasure to be here talking at this conference about something very dear to my heart. As mentioned, I'm a surgeon at the Children's Hospital, but also a founder of a company called Shoebox, trying to address the problem of access to hearing healthcare, which it's quite surprising that rural or remote areas really don't have the same access. And so that was something we were trying to undertake to fix, and found a real important niche in care for the elderly as well.
So, do you want to tell us a little bit more about why this is an important problem to solve for older adults?
Sure. One of the surprising facts is that hearing loss is just so common. Between the ages of 70 and 80, approximately 93% of people have hearing loss, which is a shockingly high number. And even more surprising is that it's not a routine part of care at either primary hospitals or hospital-based care. In a recent study looking at this, they found that only 15% of adults in this age group were asked by their family physician if they had hearing problems. And the issue there is that underdiagnosed hearing loss leads to serious social and health consequences. Think about things like cognitive decline, isolation, depression, and surprisingly, things like fall risk as well.
So, those are really important points for us to address here at Briere. What was your solution?
Well, given that it was such a common thing and that there was this lack of awareness about hearing loss, which really affected every subsequent interaction you had with the healthcare system. Think about not being able to hear your physician talk about what you should do. We really felt that making it a routine, integrated portion of the healthcare intake process, just like your allergies or your medications or your health history, it should be like that. And to that end, we wanted something that was rapid, obviously accurate, and actionable. So you had a clear pathway to what to do next about that.
That sounds really great and a great process. I know you started this company called Shoebox. Tell us what solutions you've developed that fit the needs that we have at Briere.
Yeah, well, we had worked on a number of projects, some that basically duplicated a standard audiometer. And if you think about a standard audiometer, it looks a bit like you could launch a nuclear weapons from it. It's a big box, a lot of buttons and complicated. And we really wanted to take all of that stuff and everything you needed to perform accurate hearing testing and put it in a shoebox. It's why the whole company is called Shoebox, because we wanted to smallerize, decrease the cost, make it more accessible and portable. And even past making it simple and less expensive, we wanted to make it easy for people without the traditional type of training to use, which is where we came through with this project called Quick Test. Essentially, it tries to address the issues of cost, making it less expensive to administer a hearing test, make it very quick, as the name implies, Quick Test, which allows you to address the issues of what do you do if you have limited resources, like limited number of audiologists, limited booths, limited booth spaces, which makes it really hard to scale to, okay, now we're going to test every patient coming into the hospital. Quick Test essentially does these things, which is identify patients and bucket them into lower risk of hearing loss and worse hearing loss. So you can triage patients into, well, who needs to have a complete audiological workup and who's going to be okay. And really the impact of that is that it can improve clinic workflow. You don't need to send people away to get a hearing test. They can just get it on intake, but also can really improve patient outcomes even at the time of the visit. And again, imagine that you're talking with your doctor, you don't know if you have hearing loss, and you're missing a lot of salient points, versus you've got identified hearing loss, and your doctor offers you something called a pocket talker, which is a headset which helps amplify during that clinical interaction. The way it works is essentially a self-administered test on an iPad, so very accessible there. It really doesn't require much skill to use. The data is collected digitally and can be shared in any number of ways, either to the patient themselves to raise with their doctor, or through the electronic medical record, or through email. And those results are essentially so easy to understand. You don't need to be an audiologist to understand that this patient has some hearing loss. I have a short video here we'll talk through as it goes. Essentially, Quick Test starts off with a little introduction, choosing your language and getting it set up, answering a few demographic questions like age, and setting up how we're going to contact you with your results. In this case, it's set up for email. It then walks you through the task, headphones set up, and you click the button in the middle of the screen whenever you hear a sound. And it goes through different frequencies, and it goes through different loudnesses and gives you a result. And in this case, the result was very reduced, and it's broken up by ear-specific information. And those results can be sent to your next appointment, or to your physician, and so forth. And so that all happens in about 90 seconds.
Thanks for that. One of the things that we're all facing now in the healthcare system is COVID. We've had to drastically reduce the number of contacts our patients have with staff, our staff with patients. Adding a hearing test to everyone's intake, if they're doing it at the hospital, adds another potential point of contact. How do you deal with that?
Yeah, COVID has really thrown a wrench into everything that we do, particularly if you imagine doing traditional hearing testing inside a booth. Literally nobody wants to be in a closed space getting a hearing test right now. So that required some even newer ways of thinking about hearing testing. And that brought us to Shoebox Online, which is essentially the similar sort of thing, but imagine doing it in the comfort of your own home, where you're not exposed to anybody else. You can use your existing phone or equipment, computer at home. And again, that can be part of the standard workflow for intake for patients. Please complete this at home. And we'll categorize patients into good, some loss, or significant loss. And then you can have that information shared with the healthcare team as well. And you can do it on an iPad again if you want, your phone, your computer. The type of results it gives you, again, are ear-specific, indicating normal or mild or significant. And then that information alone will help motivate participants to do something, talk to their doctor, or allow their doctor to take the next step in actioning that, which might be making a referral to audiology or using a pocket talker for the clinical interaction. I have here a brief demo of the online version as well, and we'll walk through that. Essentially, when you log on to Shoebox Online portal, the first step of the test is actually a series of questions. And we found that survey questions are really informative for people that haven't thought about their hearing, but do experience some types of symptoms. Things like it's hard to understand people in noisy places, or it's difficult to hear in restaurants, or other people comment that I have a hearing problem, but I don't think I do. After all of those, it gets you set up with your own equipment, in this case, using earphones that are either wireless or plug-in, etc. And it gets you to do your best for essentially calibrating your computer, because every computer is a little different. And that's had a real impact on how we test people's hearing compared to the traditional tone testing. We do kind of a different way that is specific to Shoebox for online testing. That walks you through a number of tests on each of your ears, giving us a really good sense of whether you have a hearing problem or not. At the end, it gives you your results. And that was the demo of Shoebox Online.
So I know we ran a pilot recently in our geriatric inpatient unit at Bromwich over the last several months. There are over 60 beds. Can you walk us through that, our pilot?
Sure. So as part of the CanHealth network, Bromwich and Shoebox have been doing an implementation project at the hospital. Essentially, we started with the staff and the leadership to build, goodwill and buy-in for this, testing all the staff, which was a lot of fun to talk about. We then ran a very small pilot looking at the particular age demographics at Briere, which tends to be an older population, to ensure that using things like iPads and technology was an effective way of doing it. After that, we had the broader implementation project and then did a bit of an analysis on the financial impact. And all of that has yet to be published, but will be coming out as a part of a research paper and quality improvement project. Just a note on privacy and security, of course, because we are dealing with patient medical records. Essentially, Shoebox is a privacy by design software, which is compliant with all the Canadian and international privacy standards. The first small pilot I mentioned was at the Briere Memory Clinic. And I think this is really important to highlight that we started off with a very challenging patient population, people who already had some degree of cognitive decline. And I think this speaks to how simple and easy the test is, that even in this population, we were able to do a test on 25 patients and found that we had very accurate results when compared against traditional hearing testing. After we'd validated it in this way, we moved on to the larger implementation pilot project and found many new patients who were unaware of hearing loss in the Briere network. And the great thing about this is it improves the patient awareness of this, such that they could identify what's going wrong when they're having challenges talking to their grandchildren on the telephone and whatnot. But it also really improved staff awareness. And that had a significant impact in this way, which is when speaking to a person with hearing loss, when you know about it, you might do several things differently. You might face them. You might speak louder or slower or clearer. You might offer the use of an assistive listening device. And that alone has significant knock-on effects because the advice of the clinicians is being heard by the patient. And if you don't enable that, what's the point of the whole visit, right? And so it also dramatically increased the number of referrals to audiology, which is great if you're looking at building a business within a hospital for cost recovery. Because not only does this provide a very useful service, but is an ancillary fee-based service inside the hospital. And lastly, we are continuing to explore the use of the Shoebox online for this population. And that may be a new type of workflow where they complete this at home. I think it's really interesting to note that the financial impact and patient outcome analysis is ongoing, but other similar studies noticed that it had impacts such as fewer outpatient visits because people understood the instructions the first time. Fewer inpatient visits, which is a surprise, and fewer days per stay when hearing loss was addressed. This one's really remarkable, a 44% reduction in 30-day hospital readmission rate. So patients with long stays who've gone home, if they understood and had everything set up, they're much less likely to bounce back to hospital. When you add this up over a 10-year period, they had a 46% lower healthcare costs, amounting to about $30,000 per person over 10 years in their system. And so these are all dramatic impacts on healthcare and patient care.
So I know we'd be really thrilled if we could replicate that type of financial impact at our hospital. Dr. Bromwich, what would you want the audience to leave with after this talk? What are your top 3 points that you want people to know?
I think if I were to highlight 3 things, I would say 1, hearing is such an important and underdiagnosed condition. And it's so important because it has all sorts of knock-on side effects, as we mentioned, from depression, isolation, falls, cognitive decline. And The Lancet published an article a few years ago indicating that hearing rehabilitation was the #1 modifiable risk factor for dementia, with a 19% impact. So if you could do anything to preserve your brain, get your hearing looked at. Number 2 is that implementing a testing program is easy and inexpensive and doable. And third, the savings to the hospital system and healthcare system are large, and the impact on patient care is significant. Just think about the quality of life of people who are no longer isolated because they can hear again, they can speak to their family, and also speak to their doctors, which has important impacts on patient outcomes. So I think those are the top 3.
This is absolutely great. It's really been amazing to see the implementation of research in the real world like this. And I know at Briere, at Briere, we are thrilled to extend the online testing program while we're in the COVID pandemic. When we're back to normal, we'll be resuming with the integration and implementation of the Shoebox quick test across the hospital. And in the meantime, we're working with the Can Health Network to support the implementation of the online and quick tests in hospitals and geriatric programs across Canada. Any final comments that you want to leave the audience with?
Yeah, I think one thing sticks in my mind. One of the patients participating, it's really great to hear this. He said, I really liked the test. It was easy to use. I didn't have to wait, and my results were right there. And I think it's just summarized for me the patient experience of this, which is positive and really great. I did want to just leave with a note that, if you are interested in discussing this or other pilots or research projects with us, please reach out to us. The email address and phone numbers are there. And also that, this is in its inception, a tool to help with accessibility to healthcare. Essentially, Shoebox, again, is called Shoebox because we want to put it in the shoebox and send it around the world to everyone to improve access. And that access to healthcare enables improved, accessibility for people with hearing loss in dealing with the healthcare system. And so I know there's some other talks I'm really looking forward to that are coming up next with that. So thank you very much to the conference organizers for having us, and to Dr. Svestop at the Briere Institute for your time.
Thanks, Dr. Bromwich.